Good evening, and welcome to the Fenway Health Board of Directors Annual Meeting. I'm Jonathan Matsui, and I am proud to serve as the chair of the All-Volunteer Board, and I'm so pleased that you have joined us tonight. As we celebrate 50 years of Fenway Health, we wanted to open our doors and offer more transparency about our work and to provide you with key information about the plans we have for the future. This evening, we welcome our patients, our staff, our volunteers, our supporters, our friends, neighbors, and everyone who is part of the larger Fenway family. We have a great meeting planned for you tonight. We'll review some of our major accomplishments over the past year, and there were many. We'll also meet some new members of Fenway's leadership team, which is now the most diverse management team in Fenway's history. This is an important time for our organization, and tonight we'll share with you our bold vision for Fenway Health as we embark on the next 50 years of community health. Our CEO, Ellen LaPointe, will share our recently approved strategic plan, and some members of Fenway's Racial Equity Action Team will review some of the key points of our important Racial Equity Action Plan. Both of these plans were affirmed and adopted by the Board of Directors earlier this week. So let's get started. Several of my colleagues on the board will review some of Fenway's important accomplishments over the past year. Let's begin with Michaela Houston.
Thank you, Jonathan. Again, my name is Michaela Houston, and I am a member of the Board of Directors for Fenway Health. As we all know, the most important topic of 2020 was the global COVID pandemic. It changed our work lives, our travel lives, our children's school lives, and has shaped our social gatherings and personal interactions for more than a year. And while just about every type of business was impacted by the pandemic, few bore as much responsibility to respond as the healthcare industry and the frontline workers charged with saving lives. As soon as the Commonwealth of Massachusetts declared a public health emergency last March, Fenway Health began to dramatically adjust our operations to deliver on our mission while protecting the safety of our patients, clients, and staff. Oh, and that was basically CEO Ellen LaPointe's first week on the job. The accomplishments of Fenway Health and the extremely dedicated and talented staff over the past year are nothing short of amazing. Here's just a small sample of their incredible work. We launched a new telehealth program that allowed us to offer care and services to the people who count on us. It also allowed us to expand our reach. We now care for patients in almost 40 states, many of which have limited networks of care for LGBTQIA+ people. Our Access Drug User Health Program went out on foot, on bicycles, and in our mobile van to deliver Narcan and safer injection supplies to people in shelters and outdoor encampments in Boston and Cambridge. Our volunteers made calls to older adults in our communities, offering help with immediate needs like grocery store runs, prescription pickups, and dropping off face masks. And we published a guide to sexual health in the age of COVID-19. Very important. Fenway also made significant contributions to the fight against COVID-19, drawing on our deep experience in tackling major public health challenges. We launched a free COVID testing site in Boston, open to our patients, and one in Everett, open by appointment to anyone. We worked with the Massachusetts Community Tracing Collaborative to help with COVID infection contact tracing, and our team brought multilingual Spanish, Vietnamese, and Portuguese capacity, as well as experience working with LGBTQIA+ communities to that effort. We are also running a phase 3 clinical trial of the AstraZeneca COVID vaccine and participating in a study to learn more about how antibodies can be used to potentially stop the spread of COVID. And we have partnered with other organizations to ensure that participants in our research studies were racially diverse and representative of the communities we serve. Through all of this, we have learned a tremendous amount. Perhaps most significantly, the COVID-19 pandemic has laid bare the disparities in health that occur based on race. BIPOC people in America have a much higher rate of COVID-19 infection, hospitalization, and death than white people. Racism is a public health crisis, and Fenway Health must become an anti-racist organization to deliver on our mission. You'll learn more about that in a few minutes. This incredible response to the COVID-19 pandemic was a result of innovation, flexibility, and a lot of hard work by the dedicated staff at Fenway Health. Folks at all levels and in all disciplines were responsible for this success story, and my colleagues on the board of directors cannot thank them enough. We are in awe of these tremendous accomplishments.
Good evening. I'm Vincent Smith from the Board of Directors. As we all know, one of the most important tools we have in the fight against the spread of COVID-19 are vaccines. The first Moderna vaccines arrived at Fenway Health on December 22nd, and 4 employees volunteered to be the first staff to receive their initial doses that very day. We prioritized frontline staff with our initial supply of vaccines so that they could be better protected while continuing their essential functions. We were able to begin offering vaccines to our patients in early February in accordance to the availability and the guidance set forth by the Massachusetts Department of Public Health and HRSA. But Fenway didn't just offer vaccines. The staff actively reached out to patients who were eligible to receive the vaccines at any particular time and made a concerted effort to reach BIPOC patients and those living in higher risk communities. Phone calls, text messages, and more were part of a proactive approach to empower patients with the information that they needed and to get more shots in arms. In addition, Fenway created the Vaccine Ambassador Program. Dozens of non-medical staff members from across Fenway volunteered to serve as ambassadors during the COVID-19 vaccination clinics. Ambassadors greeted patients as they arrived for their scheduled appointments and assist them in filling out pre-vaccination paperwork. They explain how the vaccination process works and answer questions patients may have about the vaccines and potential side effects. With the help of these ambassadors, patient services staff are able to spend more time on patient outreach, and our medical providers are able to focus entirely on administering vaccines and caring for our patients. On May 3rd, we were able to open our COVID-19 vaccine clinics beyond Fenway patients to the general public. As part of our continuing efforts to improve accessibility to vaccines, we opened a COVID-19 vaccine in a neighborhood on the edge of Roxbury and Jamaica Plain, which began welcoming members of the general public on May 17th. Located a short walk from the Jackson Square station on the Orange Line, this new site provides easier access to some of the communities most impacted by COVID in the Commonwealth. So how are we doing over the past few months? Since we started offering vaccines to our patient population in February, we've given thousands of first and second doses. Our vaccine outreach program focused on equitable access, and we've had success reaching and vaccinating BIPOC and high-risk patients. We also know many of our patients have received shots from other organizations, and we're actively seeking the information so we can make sure we vaccinate as many patients as possible. There's still a lot of work to be done, and many more people still need to be vaccinated, but we are proud of our work Fenway staff has done on helping fight the pandemic with our most effective tool, vaccines.
Good evening. I'm Trevor Boylston. Last summer, we made our first public statement on our commitment to becoming an anti-racist organization and shared some of the work we're doing to address racial inequities. We promise to be transparent and provide regular updates on our work and accomplishments along that journey. And while we're still in the early stages of this transformation, we're pleased to update you tonight on some of the progress we've made. We established a racial equity action team in October to develop an ambitious, achievable racial equity action plan for Fenway Health. That plan is complete, and you'll hear more about it later this evening. We created a health equity task force that is using a data-driven approach to identify gaps and opportunities for improving our care and service delivery models that had previously resulted in health inequities for our patients and clients. We launched a national search for an executive vice president of racial equity and social justice. Dr. Mark Brimhall Vargas will be joining us in July. We removed the Columbus Day holiday from our operational calendar and added Juneteenth as an official organization holiday this year. We'll be marking this new holiday for the first time next week. As part of this observance, we'll curate opportunities for staff to reflect on the history of slavery, racism, and white supremacy in the United States, as well as events and opportunities to facilitate healing and learning. We actively expanded our community engagement and partnership efforts to align with organizations that can help guide and strengthen the intersection of BIPOC and LGBTQIA+ issues in our programs and services. In addition, we committed to establishing a professional development and advancement program, which will include specific annual racial equity-focused professional development goals for individual staff. The incoming EVP I mentioned earlier will help launch this program later this year. And we're continually evaluating and improving our procurement policies and practices to prioritize vendor, service, and consultant relationships with BIPOC individuals and businesses. Again, you'll hear more about that later tonight. This is not easy work, and it will take time to achieve the results we want and need. But working together, we can make Fenway Health an anti-racist organization and a model for others to follow. Thank you for your support as we continue this important journey.
Good evening. I'm Colin Gibbons, also from the Fenway Health Board of Directors. It is my pleasure to introduce the CEO of Fenway Health, Ellen LaPointe. Ellen joined us just over a year ago, right as the COVID pandemic was spreading across the country. In her first few weeks on the job, she had to build a plan to keep the organization operational during the statewide lockdown. This included having most staff transition to working from home and the cancellation of several of our important community events. It's quite a way to start a new position, and Ellen did a fantastic job by keeping the focus on our response to the virus and caring for our community. If you're not familiar with Ellen's background, over the past 3 decades, she has held numerous leadership roles in the nonprofit and public health sectors, working in social justice, research, LGBTQIA+ and HIV activism and advocacy, health policy, law, and equity. Ellen also has strong ties to our area. She is a native of Maine and began her career as coordinator of the Brown University AIDS program after earning her bachelor's degree from Brown. She later earned a law degree from UC Berkeley and spent several decades working in the Bay Area before returning home to New England and joining us at Fenway Health. And we couldn't be happier to have her leading our organization. So please welcome Ellen LaPointe.
Thank you, Colin, for that generous introduction. We are super grateful to have you on our board. We're celebrating our 50th anniversary this year, thanks to the vision and the audacity of Fenway Health's founders, volunteer clinicians, and community members who passionately believed that healthcare is a right, not a privilege. We are here today because these fierce, committed people matched their vision to a determination to do whatever it took day after day to bring that vision to life. You've just heard about some of the great work done by our staff over the past year to tackle the COVID crisis while delivering on our mission. In the face of this unbelievable global pandemic, this past year has affirmed that Fenway Health is nimble, resilient, resourceful, creative, and innovative. And it's taught us 3 key lessons that will guide us over the next several years and in the many more years to come. The first lesson is that there is no going back. The COVID-19 pandemic really laid bare the disparities in health that occur based on race. As you've heard, Fenway Health is committed to becoming an anti-racist organization by working to overcome the disparities and inequities that exist in the services we provide, the people we reach, and the outcomes we achieve. The second lesson is that our voice matters. Advocacy is core to our work, and our voice matters when public policies impacting the people, families, and communities who count on us are being advanced. And finally, we've learned that our past is prologue and our future is bright. We're going to build on the legacy that we've created. Our priority continues to be to provide high-quality care to under-resourced and underserved communities. And as we look ahead, we aim to serve an ever-broadening community of patients, clients, and research participants. Later this evening, I will share our strategic plan for the next 5 years, which our board approved earlier this week. And following that, members of our Racial Equity Action Team will share our Racial Equity Action Plan, which is a blueprint for the transformative process that we will undertake and will be core to how we do our work and embrace our community going forward. Our 5-year strategic plan was co-created and informed by our board, our staff and an array of community stakeholders and partners through an 8-month comprehensive planning process. A broad and diverse range of internal and external stakeholders shared their perspectives on successes and challenges and provided guidance on priorities. The planning process was informed by results from a core capacity assessment tool, which measures a nonprofit's effectiveness in relation to 4 core capacities: leadership, adaptability, management, and technical capacity, in addition to organizational culture. A tremendous number of people, organizations, agencies, and stakeholders were involved in this process, and I want to personally thank all of you for your enthusiasm, guidance, and wisdom in helping us to shape Fenway Health's future. Fenway Health's mission statement was revised during this process. It incorporates input from multiple stakeholders through what was a very highly iterative process. I'd like to share it with you now. This new mission statement embraces our deepening commitment to serving BIPOC communities. We have also articulated a set of core values that will inform our thinking, guide us in times of uncertainty, and provide fuel for action within our organization. Here's a closer look at these core values. Boldness. We value informed risk-taking and experimentation. We are willing to step outside our comfort zone, to fail, and to learn. We stand up for what we believe in. Community. Connection with one another to strengthen our work. We cultivate brave spaces in which people can come together to connect, be heard, and support one another. Compassion. We meet the suffering of others with openness, generosity, understanding, and acceptance, and do all we can to alleviate it. Humility. We recognize and accept our strengths and limitations. We are open to new ideas and perspectives. We make space for the voices of others. We are willing to ask for help. Innovation. We are driven to identify, develop, and execute novel approaches to tough challenges to drive progress. Integrity. We keep the promises we make to ourselves and to each other. We are honest, forthright, and transparent. We take responsibility for our actions. Justice. We believe every person is entitled to the same rights, access to power and resources, opportunity to live the life of their choosing, and respect. Learning. We ask questions to understand and embrace opportunities to learn, iterate, and improve. These values represent the guiding principles of our organization and are meant to be at the core of our work each and every day. They will aid us when we make decisions. They help us check ourselves to make sure we stay on track and course correct whenever we need to. They're going to help us navigate tough situations and keep us accountable to ourselves and to each other. Now, I'd like to share the 4 priorities that we've identified that make up our strategic plan. First, we will center racial equity and social justice in our operations, care, and services, advancing health equity among those we serve, and pushing to dismantle and redesign systems that deprive BIPOC and other underserved people of the opportunity to be healthy and thrive. This includes building a diverse board of directors committed to anti-racism, establishing a diverse team of senior leaders that advances racial equity, equipping our managers and supervisors to lead equitably, engaging deeply with the communities we serve, cultivating a rich learning environment, and fostering a culture of belonging. We're going to expand how we serve local communities effectively while exploring ways to better support LGBTQIA+ communities everywhere. To do this, we will enhance research, education, care, advocacy, and services for LGBTQIA+ BIPOC, intersectional, and other underserved communities. We will identify and develop new national care delivery models for underserved communities that incorporate telehealth and leverage partnerships. And we will expand local services beyond our current physical locations. Our third strategic priority calls on us to achieve greater impact by aligning and integrating our core services in the health center, our public health services, advocacy, research, and education and training programs. We'll do this by fostering a culture of effective collaboration and communication throughout our organization. We'll leverage our expertise and experience across core services to more effectively fulfill our mission. And we'll develop a broader unifying vision of the scope of Fenway Health's public health work and align internal systems and external messaging to advance this vision. Last but never least, we will ensure that we remain financially stable and support innovation to enable long-term impact. Fenway Health's financial picture is robust and strong. We are optimistic and confident of our financial future. Our cash position is solid, but we are not immune to external financial pressures. Our business model has to continue to evolve over time as conditions shift. We will diversify and optimize revenue streams and leverage new business opportunities whenever possible. We will also reimagine donor engagement and embrace new resource development approaches. We'll be sharing a more detailed version of this plan with you in the coming weeks. We hope that you will read it carefully and ask questions of us. We are committed to fulfilling our mission over the next 5 years and beyond through the advancement of these strategic priorities. And we'll be engaging with all of you to help us make our vision a reality. I hope what we've shared tonight leaves you confident and inspired. We're going to build on our legacy and we're going to keep getting better. Whatever your relationship to Fenway Health, I hope that you see yourself in what we are about and what we want to become. We are embracing this extraordinary opportunity to transform Fenway Health into an organization that delivers and a workplace where extraordinary people will continue to want to come to work with us and stay for the long haul. We will lead with humility. We hope to earn your ongoing confidence and support and to inspire and engage you in the work that we're doing. There is a lot of hard work ahead of us, and I hope that you will join us on this journey. I truly believe there is a bright future ahead for all of us. Now we're going to learn more about the Racial Equity Action Plan. We've invited several members of our Racial Equity Action team to share it with you tonight.
Hi, I'm Adriana Bolin. I use the pronoun she and her, and I'm the Community Engagement Manager at the Fenway Institute, the Research Policy and Education Division of Fenway Health.
All right, I'm Tafawa Haynes, and I'm a clinical social worker in the Behavioral Health Department, and I'm currently in the role of the coordinator of group psychotherapy here at Fenway Health, and I use the he series pronouns.
Hi, I'm the Reverend Amy Whitcomb Slummer. I use the she series pronouns, and I'm the Chief Compliance Officer at Fenway Health.
I thought we could start by talking about how our team came together, and more importantly, who came together, and what they came to our team with, and then going into our plan really quick. So I thought I might start to kind of kick off how we could reflect. So I've been at Fenway for 2.5 years, and I've had the honor and privilege to be both a member and now the vice chair of the Racial Justice and Equity Collaborative. And I've been able to be a part of conversations and really see action and incubation and talking about racial equity across the organization during that time. And being a part of this team, I've learned so much. Being a part of the ERG, I've learned so much. And so I'd be interested in hearing more from you all since you've been here, your experiences in that work. And how that aligns to the team that we're all a part of.
Who you want to go first? Amy, do you want to go, or should I go?
Either. You want to go ahead?
Sure, I can go ahead. I think it's interesting thinking about kind of how do we come to this conversation. So I oftentimes am in the role of being the historian. So I've been at Fenway for 11.5 years now. Actually, not 11.5, 10.5, aging myself. And I come to this conversation being one of the founding members of the Racial Equity and Justice Collaborative here. And I think the conversation started before me, and a part of my role is to continue the conversation. And one part of it is by starting the conversation around racial equity and justice years ago. I think we started about 5 years ago now. in having individuals having separate conversations within departments talking about racial equity and justice here at Fenway, and then leading to us coming together as a team and creating an ERG here, and then ultimately leading to this action plan. And I love seeing where we started in the past and then going forward in terms of incremental change. One of the biggest things that I've had to learn is that change is incremental. And I think through this process, there's been a lot of dynamics of seeing many people engaged in the conversation. And as we talk about kind of like who's at the table, like seeing people from front desk individuals to individuals in clinical roles to individuals who are on the board, seeing many members of the community that we are participate in this dynamic conversation was amazing to see. Where we started with individuals having the conversation separately, and now groups of people having the conversation to the point where we're now in an action, creating action plan around the conversation around racial equity and anti-racism.
I agree. I have been at Fenway for about a year and a half, and almost my entire tenure has had the COVID pandemic as its backdrop. And the pandemic shone light through the cracks in our healthcare system. So I arrived at Fenway grateful to hear conversations from the Racial Justice and Equity Collaborative. I've been impressed by our focus on trying to attend to marginalized parts of our populations. And this seemed like an incredible opportunity to focus some of the conversations that have gone on, as you say, Tafawa, at many different parts of the organization, to be able to bring representation together to think about what a plan would look like as a focused effort to move the entire organization forward.
Speaking of coming together, talking about representation across the organization, how did we come together? In what way and what different parts of the organization? And once we came together, what did we establish as a language for us to do this work moving forward?
Well, I appreciated that we were invited to volunteer for this effort. If we had a particular interest or were available to invest a significant amount of time, we were invited to volunteer. And there was a strategic look at the makeup of our committee so that we would reach across the breadth of Fenway and not have too many concentrated voices from one area. That will be particularly important as we look forward to implementing this extraordinary plan. But to create it, it was vitally important that we had different lived experience, different voices, and had enthusiasm for what was going to be quite a lot of work ahead of us. We started by looking at the awake, I'm not going to be able to do it, to follow.
Awake to woke to work.
Thank you.
You're welcome.
One of the things that we did as a committee together was to look at the awake to woke to work documentation and approach to increasing diversity, equity, and inclusion in workspaces and in organizational, as an organizational development discipline. And pretty quickly, as a committee, we decided that it wasn't actually sufficient for us. It was a marvelous starting place, but that we wanted to build on that and infuse that approach with some of the unique features that Fenway has to offer. So I very much appreciated that fairly quickly we decided we were going to tailor that approach as our own, to make it our own.
Yeah. I think also the other thing that you saw that just was demonstrated there is the collaborative process of like, I don't know the words, please help me with the words. One of the things that I really appreciated is getting to the table and really recognizing that we all are coming at this from different angles and coming at this from a different perspective, and we all do not have the same meaning to the same words. So what do I mean when I'm saying this? So creating, even before we get into the awake to woke to workspace, what do you mean when you're talking about anti-racism? What do you mean when you're talking about racism? What do you mean when you're talking about privilege? What's the common definition and how are we all getting here? And do we all know what we're talking about? Because I may have a stance and a perspective based on being here for 10 years. Amy has a different experience coming in after a year. Adriana, you have a different experience after 2 years. And really thinking about, as a community, how do we understand this? And I think the other part of this is, as we're thinking about health equity and anti-racism as an organization, outwards, how are we thinking about it as people in the system? Because we're also people within the systems that we're trying to impact, right? So we have to start somewhere, and really starting that work with ourselves as an organization and with the people in the organization, and really thinking about who are the people at the table, how can we inform the conversation that's happening at the table, and how do we engage the conversation that we're in. And it starts with us to engage the conversation and then go from there.
It starts with us. And we showed it right here on this video. It starts with us.
And Tafawa, I thank you for claiming that work on the shared definitions. I think that as part of one of our early steps, I experienced that as vitally important team building. I think there was interest for people who participated in sharing definitions that they brought to the table and terms that they felt were important. I think people were curious to know whether that was going to be radically edited so that it would be soft, or it could reflect the voices of the people in the committee. And I hope people are pleased with where we landed. An awful lot of people had a hand in adding to the definitions, and that will be part of the foundation for this document, is the shared language. So thank you. I agree that that was really, and it was an interesting part of the group process.
Exactly. And I think also as language develops over time too, one of the things that I really loved about it is, for me, even learning points of, oh, I didn't know, or my language wasn't as evolved. So being able to hear, oh, there's another way of phrasing this, or there are different ways. So as we go forward, one of the things that I really appreciate about this work plan, this action plan, is that this is not static, it's not permanent. This is something that we will build upon, and we will evolve with the evolving society that we're working and living in right now.
Yeah, I'll speak personally for myself on language, a learning process for myself. As I was participating in the plan, there was language that I identified for myself that I didn't resonate with anymore. White supremacy was coming up when we were going through the process of talking through language. And I realized I didn't feel good when I was reading it. And I observed this and realized, what is something that more describes how our structures and systems are impacted by a specific culture or single standard that every other diverse culture has to conform to? What is that? And white dominant culture came stronger in the language for me. It was a learning moment for me. And it was empowering for me to have that opportunity to understand and learn from that experience. And so just as we together have talked through language, I think there are a number of goals or pillars and goals that we've established throughout the plan that, from a broad sense, can support the organization through starting this work and continuing this work, because there's no end to it. So can we talk a little bit more about those pillars? And some of the goals that support those pillars?
Sure, we can divide them up or list them, but it is an ambitious and important interwoven list of pillars and goals that begins with building a diverse board that will be committed to anti-racism. And the board got to work on those goals, which was a marvelous collaborative moment. We're going to establish diverse team members and team leaders committed to advancing racial equity. We're going to equip our managers and supervisors to lead equitably. And we're going to recruit, hire, retain, and advance a diverse, talented team. Again, looking at how we currently attract and retain employees, and thinking about how we can make improvements that are focused on diversity, equity, and inclusion, so that we have a workplace that everyone feels welcome.
Yeah.
Tafawa, do you want to list the next?
Sure. I think as we really think about recruiting, we're also thinking about engagement. So engaging deeply within the communities that we serve. So as we're recruiting people in, we're engaging in the communities that we serve and really making sure that the voices of the community is represented within the organization. Not that we're coming in as experts, but really engaging in this like culturally humble. I think this is the word that sits with me very well as I think about this process, is being very culturally humble in our work and making sure that we're both listening to and engaging the voices of the community that we're trying to serve, and engaging those voices and really uplifting with our privileges the voices of the community that we serve, cultivating a rich learning environment. And again, I think tenets of cultural humility is really thinking about how do you cultivate a rich learning environment, recognizing that my learning process is not an end point, but it's an ongoing point, an ongoing position. And then the biggest piece of this that I really see is really track and leverage data and to improve the overall output and outcome of this, really thinking about what are we learning as we're doing this. And I think as I thought about this conversation, one of the things I thought about is how audacious it is to be an organization to say we want to be anti-racist and to put that out there and to come up with points that says this is what we want to work on, and this is what we feel like we need to change, and then say, hey community, I'm going to tell you this is what we want to do, and I'm inviting your voice into this. That is a very audacious stance, and I think it's a very strong stance that invites in for our own evolution and really thinking about how do we grow ourselves. And the biggest pieces that I see that fits into all of these are measures for success, really looking at what does success look like? How do we measure success, and how will we see it when it happens? Like, what am I supposed to be looking for is always a thing that I really think about. What does change look like? I think years ago when I started this conversation, really being a person who was frustrated as a person of color on staff in terms of my voice, one of the things that I benefit from now is like a measure to my own success is the fact that I can have this conversation today and represent this action plan that, oh wow, there has been some changes. I think I've had like a offside conversation with you, Adriana, around like years ago coming up with at a kitchen table with a couple of us who were talking about the ERG and saying, I would like to see Fenway at this place 5 years from now. And I looked it up on my desktop and I found what I back then we called Fenway 2023, what we audaciously saw for 2023. And on that thing was having an executive vice president for racial justice and equity. And also on that was also having an action plan for how do we do this. Past me had some premonition that at some point we would get here, but I don't know back then if I believed in it. And I think current me is very happy to see that we've come up with pillars that we can look to say, here's a structure that we would like to frame, and here's how we would like to measure it, and here's how we guide in terms of the work forward, putting one step in front of the other, as we really try to, in some ways, retrofit some pieces of our organization, but also build forward in the organization and really engage in being an anti-racist organization and taking a step forward in standing firmly in we have to become anti-racist. I think last year has proven to us that we really have to take a stance and we really have to develop a voice. And I think our plan helps us develop that voice and helps us develop that stance and helps us evolve as more data is pulled in and as more information comes in and as we engage in community and as we engage in our own internal community as well as external community.
That hit me right here. So I'm taking that into follow.
Part of what excites me about this plan is we are committed, we are in writing, and we have incorporated the expectation of becoming an established anti-racist organization with the understanding that we have to look at our history and name the fact that we are the product of political systems, economic systems that have provided preference for white people. And we are saying that we want to understand the impact, and we're going to undo the impact so that we are not relating to BIPOC brothers and sisters as other, but as all of us, that we are committed to being a fully inclusive, welcoming, but affirming organization for all people.
It makes me feel really proud, especially during a time where different things can be going on in the world, or several things that are exhausting, that are horrifying, that are hard. But to have the privilege and honor to show up to work, not only as yourself, but to show up and do work that you know is important and that there's a global awareness around now is so fulfilling and it's energizing. And on days when the world is exhausting, it really supports keeping me energized to do the work, and feeling privileged to be here with you all to do that.
I feel that. Yes.
So coming to a close now and wrapping up, for you as an individual, what do you hope this work will mean for the future of Fenway?
I know it means we're going to talk about race, and I think that is vitally important. I know it means that we're going to help build skills and comfort across the organization so that we can center those conversations in ways that are productive, that lead to the rich learning environment that Tafawa mentioned as one of our pillars, so that we can be an example of an anti-racist organization better able to deliver on our mission to our patients and clients that will lead to our realizing our mission in more powerful ways than the people who wrote it originally could have envisioned or did envision. I'm very excited and energized by that.
Yeah. So full disclosure, I teach a class on racism, and I actually just taught it an hour before this. So one of the things that I just had a conversation around is that dialect, the conversation between the both and. I hold both excitement and I also hold a level of frustration, anger, sadness that is still rooted in hope because I'm still here. I am excited to see a tangible action plan. I'm excited to see a movement forward. I'm excited to see a plan. I'm excited to see a frame that I can name that I participated in this wholeheartedly, and I can present this to someone at any stage of their tenure here at Fenway, whether it be at the beginning when they're just coming on, I could say, hey, here's what we're working on. Someone who's in the middle phase where they're like, I'm feeling very frustrated, or someone who's really energized and say, I really want to work on something. What are the things that I could be working on? And someone who's on their way out who will be a representative of a person who has worked at Fenway, but has experience with what an organization can do. I'm excited about all those things. And I think the part of me that holds a bit of sadness is the part that I see the impact of racism still as a Black man navigating the organization, navigating spaces where I still question my voice. I still am hesitant. I'm still impacted by racism in the world that I live in. And the both and is happening there. But I think that both and is necessary to engage in this work and to hold and to honor in this work. So my excited part is both looking back and holding that part of me that is sad and saying, hey, I got you, I'm here and I'm willing to engage with you in this work. And that represents the people who are in the spaces that are being impacted right now. So as we engage in this plan that has pillars that we're looking at it from 1 year to 12 months, from 12 months to like 36 months, and how we go forward, it's engaging in some pacing and some patience, but also there's a part of me that's saying, I want it to have happened yesterday, and being able to hold those two things embodied in myself and embodied in the people that I support, embodied in the people that I care about. So I think that I'm in this moment really thinking about the both and really thinking about the fact that this is amazing in our work together, and we have our work cut out for us. And I'm very much so committed to this work. And I'm also very much so committed to passing this on and passing the baton on to others when it's time to pass that on. It's not right now, but when it's time, I know that we've created a frame that others can plug into and evolve beyond me. And I'm excited to see where this goes with me, and also immensely excited to see where this goes in a couple of years beyond my lifetime, to see what this leads to. I think I'm thinking about my first time like walking and seeing Pride as a young Jamaican kid coming to America at 10 and bumping into my first Pride parade. And now being a 37-year-old about to be 38, looking back at that kid and saying, I am working in an organization that I'm in an LGBTQIA plus organization that is really trying to root all of your identities within the same space. And you are a part of that. And you stood there very confused as to what is this parade with people who, oh my God, this is amazing. And your parents are having this reaction of what's going on. And now you have participated in a dynamic conversation to really impact organizational and systemic changes that hopefully will have a ripple impact, not just on Fenway and Fenway's community, but completely beyond us, and be an exemplary example for people beyond us to say, we can actually make some changes. So while sad, I'm still also very, very, very excited about it. So that's where I'm sitting.
So Fawa, I'm thinking about what you shared about Fenway 2023, kind of sitting at that table and somehow seeing this time into the moment now. And when I think about what this work means for Fenway Health, or what I want this work to mean for Fenway Health, is, you know, seeing someone that looks like me and has my lived experiences walk into Fenway, interact with Fenway, engage with Fenway, and feel seen, valued, appreciated, and taken seriously. I really look forward to that time. And the work that we put into this plan, the intention that went into this plan, I really see that clearly, and that's what I'm holding on to.
Thank you, Adriana, Tafawa, and Amy. That was wonderful. The Racial Equity Action Plan is going to be an integral part of everything that we do to achieve our strategic priorities and goals and to fulfill our mission. We're going to be sharing the full plan with you in the coming weeks, so you can read it in greater detail, and we would love to hear from you. Several months ago, we announced that we were launching a national search for 5 key senior leaders. Following a robust process that attracted highly qualified candidates from all over the country, I am so delighted to introduce these people to you tonight. Here are the newest members of our leadership team. Cheryl Caton joined Fenway Health in early May as our Vice President of Resource Development and Donor Engagement. Cheryl is the first openly transgender person to join Fenway Health's leadership team. For the past 27 years, Cheryl worked for Boy Scouts of America, where she presented at work under her masculine identity. She was the executive director of Spirit of Adventure Council. It's a semi-autonomous Scout affiliate that serves 12,000 youth and their families from 76 cities and towns in Eastern Massachusetts. She was there for 11 years. Stacy Burgess joined Fenway Health in mid-May as our new Vice President of Communications. She is the first African-American person to join Fenway Health's leadership team. Stacy has 20 years of experience in strategic communications and marketing, most recently at American University, a global research institution in Washington, D.C., where she was the Director of Public Affairs. Dr. Mark Brimhall Vargas was recently named our first Executive Vice President of Racial Equity and Social Justice. Mark brings more than 25 years of lived experience and professional experience in change management, organizational development, and training and programming around systemic inequities. He comes to us from Brandeis University, where he was Chief Diversity Officer and Vice President for Equity, Diversity, and Inclusion. Mark's going to join Fenway Health in late July. Amy Carew-Lyons was just named our first Chief Clinical Officer. Amy is a nurse practitioner with a PhD in population health focused on health equity. She brings 30 years of experience designing and implementing high quality, equitable, and cost-effective clinical programs and practices. Most recently, she served as Chief Operating Officer and Chief Nursing Officer at Franciscan Children's Hospital, where she oversaw a staff of 650 and a budget of $65 million. Amy will join us on Monday. And finally, we're expecting to announce our new Chief Operating Officer very soon. Stay tuned for an announcement coming. We're very excited. We're really, really fortunate that these people have chosen to join us for the next chapter in the extraordinary history of this wonderful organization. These folks and other members of our leadership team are going to be tasked with leading us through this important work around implementing our strategic plan and realizing our vision for the future. I know that they are looking forward to meeting and working with you. Now I'd like to bring back our board chair, Jonathan Matsui, who will say a few final words.
Thank you, Ellen, and thanks for sharing such important information with us tonight. The future of Fenway Health and our community is in good hands, and we are all looking forward to implementing these important initiatives. While there have been challenges, there have been many successes to be proud of and many people to thank. First, I want to thank everyone who works at Fenway Health. Thinking outside the box does not even begin to describe what folks were tasked with during this past year to care for our patients and clients in the face of a global pandemic. You responded with incredible determination and creativity. You kept Fenway operating and true to our mission, providing care for those who need it most. Thank you. I also want to thank Gary Bailey and the members of our Racial Equity Action Team. You've listened, learned, and collaborated together and have given us a roadmap to be the kind of organization we not only want to be, but that we need to be and we will be. Thank you. I also want to thank all of you who have joined us tonight for our annual meeting. Whatever your connection is to Fenway Health, you are part of our family and you help make us stronger. Thank you. And finally, I'd like to thank my colleagues on the volunteer board of directors. I've never met a more dedicated group of professionals brought together through our mutual commitment to Fenway Health. 3 members of our board are retiring at the end of the month when their terms end, and I'd like to publicly thank them for their service to Fenway Health and our community. Thank you, Seth Levinson, Lisa Payne, and Bianca Robinson. We appreciate all you have done for Fenway Health. We will have several new board members joining us at the start of our new fiscal year on July 1, and we look forward to welcoming them to the community very soon. As we sit here tonight, we normally be celebrating Pride here in Boston and across the country. The AIDS Walk would have been this past Sunday, and our annual Chandler Street Block Party would have been this coming weekend. For the second year in a row, we're not able to gather and celebrate the joyous sense of community that normally are part of Pride each June. We are proud to once again be partnering and supporting Trans Resistance on Saturday, June 12th for their March and Vigil, as we did last year, empowering trans women of color. The AIDS Walk will happen later this year on September 26th, and there are a number of virtual Pride events happening around the country this month. But I know we all miss seeing each other in person. In the meantime, as members of Fenway Health community, we've heard many things of tonight of which we can be proud of. Thank you for joining us tonight, and thank you for all you do for Fenway Health and the communities we care for. Good night.